Okay, so we are going to get started. My name is Dr. Erkeda, and we are here for this Health Tech Highlight, another one this week with Dr. LouAnne Giangreco. And I'm just going to give you an opportunity to just tell us a little bit about yourself.
Absolutely. Well, thank you so much for having me. I'm really excited for our conversation. My background is I'm a board certified emergency medicine physician and had the opportunity to spend time in the emergency department and recognize that there was really a great opportunity to help build great systems and develop my interest in quality. And from there, I've had the opportunity to work at health systems, have worked with payers, have worked in startup companies, and have worked in some urgent cares as well, some outpatient settings, to really think about how we can work differently to transform healthcare. So I'm really excited about the conversation that we're going to have about technology and quality.
I'm so excited too, and especially because you just mentioned that you have an extensive history in healthcare leadership. Typically, when I speak with someone, they're like, "Oh, I work with payers," or "I've been a traditional hospital medicine doctor for 20 years," or "I'm a startup doc." You're doing it all. So you have extensive leadership across like the healthcare ecosystem, from emergency departments to hospitals to clinics to insurers. So, my question for you, since this is LinkedIn and we know that LinkedIn is for leaders, so if you guys aren't maximizing your LinkedIn, you should start. What is your advice for leaders on how to grow and build great teams? Since you've definitely been leading a lot of different kinds of teams.
Absolutely. So I think it first starts with if you have that opportunity to really think about how do you hire for success. So thinking about what are the roles and responsibilities that you're really looking to fill. And I think having those real clear expectations about what that looks like, making sure it aligns back with your organizational mission, vision, and values as well. And thinking about as you're hiring individuals, are these the people that are really going to help us to achieve our mission and vision? As well. And then thinking about as you take that job description and you're in the moment of actually interviewing somebody, how do you make sure you use a rubric to really capture that this is the individual that we're going for? These are the key skills, these are the key competencies that we're looking for. And we're seeing this throughout the interview process as well. And so it's not just what we do, but how we do it too. So some of those professional competencies, and if we're hiring other leaders as well, what are some of those leadership competencies that we want to see?
I love that you mentioned that because it's so important, number one, to make sure that the person that you're looking for, that is you're interviewing for the position, is aligned with your mission and values and goals for your organization. Because you can have wonderful candidates, but they may not necessarily believe in your cause, and that can only like stifle your growth, your innovation, and even your culture. And then in addition to that, like having a rubric to make sure that people are meeting the quality and the standards of the employees that you want, they're fitting the job description. I find, especially in startups, there may be, or smaller community health centers and things like that, there may be this thought process of giving people an opportunity, which can happen and be great for some people, but because of seniority, because they've been there, or there's no one else that wants to, sometimes you may need to hire external for the best person for the job. It's really important.
It is, and you don't know who you're hiring unless you really set out before and plan who you're hiring for. What does that role really look like? So you can really make sure that you are hiring for success. And I do love that too on an individual basis as well as an organizational basis of how do we really make sure our values are aligned and that we're in the right place for us.
Absolutely. And then once you have your leaders in place, or even your employees who are busy bees doing work, do you recommend doing any type of leadership training or performance coaching when you have this staff together?
I do. So I think in terms of both leadership training as well as coaching, which are two different categories, really completely, is thinking about how do you support people. So as we think about what people need as a leader, as well as how they can show up as a leader, really helping to build individuals competencies in those areas. So when I think about us as healthcare leaders, we have learned medicine, but in medicine, we didn't necessarily learn things like finance and how to read a P&L, or maybe we didn't learn about marketing skills that could be important, or IT. So how do we make sure that we're building up future leaders to be able to really span that world of the clinical world and the business world, to really be that bridge, to create really great programs for the patients that we serve. Also, on the performance coaching side, I also really recommend having a coach too. They are great individuals who are able to be there to walk side by side with you. They recognize that you as an individual are creative, resourceful, and whole, and they're able to provide you some of the tools and ask some of the questions too that help to guide you for your solutions to your problems in your life too. So I have a coach. I serve as a coach too, because I think it's just a great value to have as we navigate some of the complexity of the work that we do.
Absolutely. That's so important. Number one, training your leaders, making sure like everyone doesn't start at the same place. And even if you have leadership skills or you've served as a leader at different organizations, the culture may be different, the goals may be different, your purpose may be different, your role may be different at a new organization. So making sure that you're fitting and you're trained for the job that you're doing now is so important. And in terms of the coaching, I love that one of my biggest mentors, definitely when I first began my roles in leadership, was working to help us in terms of being managers, like not just tell people what to do, like get to know them, get to help them and develop them and help them grow and kind of lead as a coach and not as like someone that's like pointing your fingers. And then as well, like for the leaders, like I love that you mentioned that you coach and you have a coach. I've had so many different coaches over the years. I have a business coach now. It's so important, and it can help you not only figure out how to get things done, but how to get them done well, and also kind of hold you accountable for opportunities for growth as well as like professional growth.
Absolutely, because I think those competencies that you first develop in your career, your professional competencies that get you to the next level as a leader, don't necessarily take you through your whole leadership journey too. So really thinking about how do you evolve from great communication, but what does great communication look like as a leader? How are you influencing across teams too? So having some of those skills and support can be really valuable. And it's a complex world that we function in. It's complex systems. How do you make sure that you have people in your corner who are really there to provide that care and support along the way? We need to do that as a network. So it's really great to have those connections through leadership training and through coaching and all the networking that it helps to provide.
Absolutely. Do you recommend having formalized coaching in terms of departments, or do you recommend that like certain organizations provide like how we get CME funding, like get funding to go and have a personalized coach?
So I've seen it in a variety of different settings. And where I really was first introduced to coaching was when I was at a health plan. And we had an individual through our HR department who was a specialist in organizational development and was really able to be there to help us navigate that complex kind of matrixed organization, and the areas where we came into contact and where there might have been some conflict too, how to really navigate that and work with us as a team in that space. And that individual actually helped to serve as a team coach too for a senior leadership team in a different organization that I worked with also. So I think there's a lot of benefit too in kind of building teams and helping to really build strong teams and work through some of those challenges so that the team comes out stronger. But then even on the individual basis too, as we navigate some of our roles and responsibilities, having that person who's able to kind of guide you through is really key. And I think it's as you kind of go up into different organizational roles and you have more senior leadership roles, it gets kind of that lonely at the top of having extra support is really helpful.
Absolutely. And now you're leading in a different way. Like we talked about when you first gave your introduction, for those who may be catching this a little later, that you are really committed to quality. And quality means so many different things in healthcare. There are so many even different definitions. but you are the Chief Medical Officer of American Family Care, which is the nation's largest network of walk in centers providing urgent care, occupational medicine, and accessible primary care services, which is near and dear to my heart because I'm trained as a family physician. And we know that providing care that is of quality is very important. So, number one, how do you define quality?
So I do like to go back to the Institute of Medicine definition of quality. I think it's a really great guide for us on that journey of quality. And so really thinking about what health services are we delivering and how is it going to have an impact on the health outcomes of those that we serve, and really develop that with a consistent basis of medical knowledge. And thinking about those classic domains of healthcare quality: is it really safe? Is it effective? Is the patient in the center and not in the middle? Are we delivering those services in a timely manner? Is it efficient, and is it equitable? So I think that's really kind of that fundamental path. When I think about it programmatically, when I'm developing quality programs, I think of kind of the two big arms of how we can divide things. Our quality from an outcomes perspective of how are we delivering better health outcomes, and how are those components of quality fitting in there. And thinking about how do we develop really safe care as well, that's low risk care, that we're not causing any harm to our patients unnecessarily.
I agree with those definitions. Definitely, they're kind of like a combination of the Institute of Medicine, the WHO. Like, what are we doing? How are we trying to hit the quadruple, or now they're calling it the quintuple aim? And how are we doing it efficiently, effectively, and safely, and keeping our patients in mind? So, with that, and with your organization kind of prioritizing quality as you should, what is your advice for maintaining quality throughout the system with it being such a large network of organizations?
So I think it starts fundamentally with relationships. So I think that concept of nothing about me without me not only applies to our patients, but the teams that care for them as well. So thinking about how do we bring people together differently to start to think about clinical pathways. So we know healthcare is a complex system. There are patient factors, there are task factors, there are staff factors, there are environmental factors. How do we really build the teams to make sure we're taking all of those things into consideration? So we know when we focus only on the clinical kind of quality of care, that we can sometimes miss things in the delivery of care. That I think it's something like 80% of back pain care delivered in our country isn't guideline driven. And it's not because we don't know or have the best of intent or training, but it's really because the system isn't really set up to support the people. So I think there's a lot of opportunity for us to bring people together differently in support of that. I also think, quality is its own area of expertise. So making sure that we have subject matter expertise in quality and performance improvement, that we're bringing those folks to the table, that we're training different business area folks in some of those tools and resources too, that we're utilizing tools consistently, that we're educating our teams to be able to really support that work. And we're building the psychological safety and trust to be able to work in that environment, to be able to talk about where there's an opportunity for process improvement. I was talking to somebody yesterday and they said, we're not a know-it-all team, we're a learn-it-all team. And I just love that quote too, that yes, this is an opportunity to be able to really be comfortable in talking about where our opportunities are and growing in those opportunities.
I love that. Like, there are so many opportunities, and I love that you mentioned that it's very important to have those key stakeholders at the table. So, not only, of course, the clinical team, of course, the leadership and administration and all of those type of things, but people who are on quality, people who are focused on risk management, compliance, all of the different things that come together to ensure safe patient care. So it is very important for organizations to keep that in mind and not just call people in when they have a question.
Absolutely. So I think you're right. And how do we do that? And how do we utilize the voice of individuals? How do we utilize data differently too? How do we look at not just quantitative data, but qualitative data, and get people really comfortable at understanding what the data is telling us? Sometimes we manage the measure, but don't think about the whole process that goes really around that too, that our metrics are just like our temperature or our blood pressure. They're just a kind of a point in time that's giving us an idea of the whole health of the process or the organization.
Absolutely. So, speaking on that and like how you guys are developing systems, how you're using data and leveraging that, how has your team been leveraging technology? Because this is a health tech like conversation. Do you guys leverage any technology to impact the way that you deliver care or patient outcomes?
So I think that's always an area that's kind of a work in progress too. Of course, like any other healthcare organization, we have our foundation of our electronic health record, and then thinking about how different technologies really converge upon that information as well as some other data that we have to be able to deliver results. So we're thinking about, what does our front end process look like? Where is there opportunities in development of our patient portal? How do we intersect with other health tech vendors too to be able to deliver a seamless patient experience? And where does AI come into play too? And so we've had some conversations with different vendors and spaces in terms of our front end process, where there's opportunities in AI scribing too, to make it, back to your point about the quintuple aim, a better experience for our teams as well. Where are there opportunities for AI and revenue cycle management? Also, as we're thinking about transforming documentation into billing and coding and making sure that's really accurate, as well as we've had some conversations with some vendors who are building out clinical decision-making support. So there's a lot of opportunity. It's a great frontier. The challenge always is how do you coordinate all that technology? How do you make it a smooth experience for everybody? And how do you really make it a high value proposition that it delivers great quality, a great experience at the lowest cost?
I love that. That's my language, literally, of everything that I'm constantly thinking about. For those who are watching, I am a physician. I'm chief medical officer of an organization that is focused on women's digital health. But I do have a consulting firm that focuses on how do we safely implement digital health from a risk management perspective. So AI is something that is definitely in a lot of conversations everywhere you look. And it should be because it's exciting. It can help with this efficiency. It can help with the quality. It can help us examine the data effectively, all of the different things. But with that great opportunity, there comes great risk. So we always have to think about, like you said, how to intelligently navigate that and not just jump on the first thing. So how do you choose your vendors? How do you make sure they're in alignment? Will there be interoperability? Will you have these safety mechanisms in place? Will you have the oversight and the governance? Will you have the protection of the patient information? So there's all of these things coming together, and we're having great conversations about that. For those who may be new to my health tech highlights, which is probably all of you guys because it's only been about a month or two. Um, I have some independent conversations going on where I'm kind of going through some of the new regulations that are coming out, like the exciting one on AI innovation, governance, and risk management from the White House. And I'm actually going to have my first live event. So everyone's welcome. I'll put it in the chat. I'm just going over how we can structure these things. But it is very important because when we're talking to different organizations, and you may be like, oh, we're just urgent care, like we're in every healthcare organization right now is a digital health organization. So, how are we implementing the things safely so that we can have great outcomes for our patients, but also work, like you were saying, with the leadership and our employees to have the best experience?
Absolutely. And it's wonderful that physicians like yourself are coming into this space too, because to your point, it's a complex system, and we have people's lives in the line too. So it's great to make sure that we are really taking that time to build out to be able to meet those complex system needs, and that we have quality and safety first and foremost at mind.
Absolutely. And I know that for you, one of the big things that you are passionate about is the effect that it has on workers in healthcare. So as we've seen, like AI can do great things, and not only AI, but like it can allow people to work at their top of their licenses and help for people to expand and be able to do things that they were burdened by before. And we know that we have a doctor shortage, and sometimes there are things in the news which makes people a little afraid. Like we may have seen how Kaiser's nurses in San Francisco went on a little, they had some picketing just because they were a little nervous and it hadn't been explained to them how technology would be leveraged. So we know that some of these things can be multifactorial, but things like the shortage can be affected by the administrative overload or lack of autonomy. So, are there ways that you can innovate as a leader to impact those stresses and kind of work to diminish burnout?
So I think you're spot on in terms of, let's bring people to the table to have these conversations. So I think we need more clinical leaders in healthcare, whether it's hospitals or private equity or payers who really understand clinical medicine and can communicate back with teams, have taken care of people, have held their hands during the toughest moments of their lives, to be able to kind of come to the table and help to serve that bridge between what happens at the bedside, what's happening with our clinical teams, and what may be happening with technology or leadership, administration as well. So I think that's just so fundamental to have that. We can't work in silos because, to your point, when people feel left out of some of those decisions and aren't aware of what's happening, it's when some of that breakdown can happen too. I think, again, going back to that concept of complex systems too, of making sure that we really have the people to be able to support the teams for implementations. I think we've all in our careers have gone through difficult, whether it's EHR implementations or technology implementations too. And by not utilizing some of those process improvement techniques and good project management skills, there have been really kind of bumpy roads along the way. So kind of sometimes you have to go slow to move fast in implementing something that's really supportive of teams.
Do you think that something like implementing coaching can help with burnout?
I do. I think there is a benefit for coaching, not only to kind of have that trusted person in your corner and to be able to kind of work through some of those experiences, but also as we kind of build and grow as leaders and have some of those tools. I think having a coach is so helpful to work through some of the challenges. Those moments where you're feeling very reactive. There's a concept in coaching called going from the reactive to creative journey, of really walking through you, helping you to kind of reframe as well, and really figure out for yourself, what are those next steps that I need to take. Coaching helps with understanding what your values are, what your purpose is, and making sure that you're really in a place that's aligned with your values and purpose.
That makes a lot of sense. And I think that a lot of times I've talked to several coaches, whether or not it's on here or on the podcast, and a big question that comes up for people who may not be familiar is like, what's the difference between a coach and a therapist? And I love to hear your thoughts on this, and I'll share mine.
Excellent. So a therapist is somebody who works with you retrospectively on things that might have happened in the past and that you're kind of taking with you forward in the future. A coach is more present moment focused and future focused as well. So whether you're talking through your values, your vision for yourself, your purpose, or you're talking through, maybe something that's at work, you're really focusing on something that's current. And you're the one who's kind of being walked through what's the best solution for you. So I'm interested in your thoughts.
I love that. That's my understanding is more, and it seems like it's in alignment, but more of like therapy is kind of working through things that have happened to you, and that's more past driven, looking back. Whereas coaching is looking forward for the opportunities for growth, for what your goals are, and making sure they're in alignment, like what you said.
Yes, I think the other place where people sometimes
So continue.
Oh, I'm sorry. I think there's a little lag there. So I think the other place where sometimes there's confusion is coaching versus mentoring, where a mentor may have walked in the shoes before you of where you are or where you want to be, and is there to give advice based upon their experience. Coach is kind of a separate experience where it's about you. They're not there to give you advice. They're there to listen and pose questions and reflect back to help you come up with your answers.
That's a good point because mentorship definitely comes up a lot. And especially in healthcare or technology or being a female or being from an underrepresented group, you may wonder, like, yeah, I got to go and navigate and find the mentors and things like that. And in my perspective and some of my friends is a little different in terms of like how do you even find a mentor. I love to think about it as like building your personal board of directors,
I
whereas
love that.
you're not necessarily to someone and being like, will you be my mentor? It's a relationship, like you said. It's all about building these relationships. So you may go to one person for one thing, like say someone who may be in a position, your boss or your someone that you connect with at work that may have a little more experience than you and you want to get advice from them. Or you may have another organization you're working with or someone at church or your family member, your friend, your mom, and you don't go to them with every particular thing. So they may mentor you in one space, but you have all of these people that come together as your little circle that are like rooting for you and they want the best for you and they're doing it for free, as opposed to a coach who's also rooting for you and wants the best for you and all of the things, but it may be a different type of relationship.
It is, and the coaching relationship, it can be it tends to be more bias free. Where if people in your life might have a certain vision for you, the great thing about a coach is it is an impartial person kind of coming to the table. But you do need that mix of coaches and mentors. You need the people who do know you, who are able to share different perspectives. And I love the concept of a board of directors too, from the different facets of your life. That's a great concept.
Absolutely. Thank you. But it was so great to chat with you. I know that people are on the go. They could probably hear us talking for hours, but y'all just go and rewind this and get your key points and reach out to us and ask us more questions. So I love everything that you're doing. I love the leadership that you are bringing towards American Family Care as well as other organizations and the aspect of coaching. Do you have availability to coach people? Like, do you coach executives? Do you coach anyone that reaches out to you? How does that work?
I do. I am open to coaching anybody. I think, we are all leaders from where we sit, even if we don't have a leadership title or role. So you can find me on my website. I have a website. It's www.louannemd.com. And on there, you can sign up for a free coaching session if you want to just try it out and see, is coaching really for me? Is this something that would work? I am accepting new clients and would be happy and grateful to be able to coach the people who are listening.
I love that. So, for those who are listening, I'm going to put that link in the comments as well. So, definitely reach out if you have any inkling and you want to have that extra support. And for now, I'm just going to give you an opportunity to just say goodbye to everyone.
Great. Well, this has been a wonderful conversation. I really am so grateful to be able to talk about healthcare and quality and safety and how it intersects with technology. And first and foremost, the people that we take care of and the wonderful people who are taking care of the people. So thank you so much for what you do and for this opportunity today.
Well, it was such a pleasure to meet you, such a pleasure to talk with you about all of the different things. Anyone who has watched this long into this is committed to healthcare excellence and quality and all of the things. And like we mentioned, all healthcare organizations now are digital health organizations. So, regardless of where you are in your realm of digital transformation, it's definitely good to look into your resources, to look into how to better use your data, how to better use your information, how to partner with appropriate vendors and startups and all of the things. So stay tuned as I interview more guests about these topics. If you want to talk to me about my organization, Digital Risk Compliance Solutions, definitely reach out to me about that. And if you want to join that live event that I put in the chat, reach out about it as well. So I'm so honored to speak with you, and I can't wait to see all of the great things that you're doing in the future.
I feel the same way about you. I'm looking forward to staying connected.
Me too. Bye, everyone.
Bye.